Yet another key decision that the strategic purchaser needs to support purchasers, governments, countries to take is that decision on how to pay, otherwise known as the provider payment mechanism. The defining characteristic of a payment mechanism is the unit of payment. And I'll tell you what I mean. Some purchasers could decide to pay per service. Per service is the unit of payment. In other situations, the unit of payment could be per visit, per case, per diagnosis, per bed day, per person, and the list goes on. Now, how a provider is paid, the unit of payment creates an incentive for the provider. Again, I'll explain that to you. Typically, when a provider is paid per service, there is an incentive to increase the number of services. When a provider is paid per visit, there is an incentive to increase the number of visits. When the provider is paid per case, there is an incentive to increase the number of cases. And when they're paid per bed day, there is an incentive to increase the average length of stay of patients in the health facilities. When they're paid per person, there is an incentive to increase the number of patients. Now, none of these methods of payment, none of these units of payment are really terrible, and none of them are wonderful. They all have benefits and challenges. The job of the strategic purchaser is to work with the purchaser, with the government, with the country, to determine what they are looking at that time. What is the context of the health system? What are the health sector goals? And then work with them to choose the right mix of payment mechanisms that will help them achieve their health system goals and also ultimately achieve better health outcomes.
This message is brought to you by the Strategic Purchasing Africa Resource Center.
In our next episode, we now look at other cross-cutting issues that the strategic purchaser has to be mindful of.